Hi, my name's Dr. Anita Star. I'm a dietitian, and today I'm going to talk to you about infant feeding. I've been meaning to write a blog on infant feeding and formula feeding for quite some time, and I just haven't got there. And so I thought I'd try something new today and do a video blog and see how that goes. So let's give it a shot. So I guess it's really, I think in the media lately there's been a few interesting things that's really got my attention and thought I need to get this information out there. And in the last week we've seen a book thankfully pulled, which was about the paleo diet for babies. And the main controversy in that book, and the reason why the publishers didn't go ahead and publish it, is it contained a baby formula made out of liver and bone broth and things, which is totally inappropriate for babies and quite dangerous, as recognised by numerous health organisations, both nationally and internationally. And so thankfully it was pulled, but obviously people are looking for alternatives and looking for answers when it comes to infant feeding, and I guess that's why I thought it was so important to address these issues today. Also, not so recently, but still relatively in the recent past, was a really interesting study published in the Maternal and Child Health Journal by Christine Barra and a couple of her colleagues out of the UK and Spain. And they looked at mothers who were feeding infants in various scenarios, both those what they intended to do while they were pregnant and then what they actually did, so whether they breastfed or formula fed. And it was really interesting what they found in relation to postnatal depression. So the babies that were breastfed, their mothers had much lower rates of depression than mothers who formula fed their babies. But interestingly and quite concerningly, those who intended to breastfeed but then found they could not were actually at much higher risk of postnatal depression, even compared to the formula fed the mothers who formula fed their infants. And so I think that that's really concerning, that there's so much pressure around breastfeeding, and it is such a good thing to do to breastfeed, but it's also really important to know that there's help available, because it's not always easy for everyone. I think sometimes health professionals make out it's the easy, natural thing to do, and it certainly is the natural thing to do, but it's not easy for everyone. And so there is help available when troubles arise. And also that if you try, there are safe alternates available, and we'll come to that in a little while. So in terms of breastfeeding, why is it so great, and why is everyone encouraged to breastfeed? Well, breastfeeding it is basically what nature intended, and it hasn't really been replicated in any of the commercial formulas available. And so breastfeeding, we know, for example, prevents a number of infectious diseases in babies, and in babies these things can be life-threatening. So we're talking about diarrheal diseases, respiratory infections, ear infections, and all sorts of infections. And so that's a really strong case for breastfeeding. That's a really strong evidence that breastfeeding prevents those things as compared to formula feeding. We also know that for babies who are breastfed, they're less likely to become obese children and therefore obese adults, and also less likely to experience a lot of the chronic diseases associated with obesity as they grow up, so diabetes, cardiovascular disease, etc. We also know that breastfed babies are less likely to experience a number of autoimmune diseases. So that's really interesting. So things like allergy and type 1 diabetes. And lastly, but definitely not least, we know that babies who are breastfed have higher IQs and better cognitive performance as they mature. And so I think that they're really strong, compelling reasons to try and breastfeed your baby, for the baby. But it also offers many benefits for the mum, and we heard about the benefits in terms of lowering the risk of postnatal depression for mothers. We also know that it helps with weight management, which is really important. So a lot of women put on weight, obviously, obviously, as expected during pregnancy. And then to help lose those fat stores, breastfeeding certainly takes a lot of energy and can help facilitate that weight loss after the baby is born. And we also know it's associated with some decreased risk of breast cancer, ovarian cancer, and uterine cancer. And so again, it's really compelling evidence that it's helpful for mum to breastfeed as well as for her baby. So that's really, really good evidence that breastfeeding is great. And it is natural, but as I said before, it doesn't come easily for everyone. And I think that's something that's really important to acknowledge, because sometimes we do make it sound like it's natural and it's the right thing to do, and therefore people assume that it should be easy, but it's really sometimes not. And certainly you can learn to breastfeed, and people find it easy after they've been doing it for a while, but sometimes you can experience difficulties that make it a little bit hard. So I've been talking to some friends about their breastfeeding experiences, and I've got a close friend who's breastfed 3 children successfully, and she had a wonderful experience and loves breastfeeding and enjoys it for herself and for her children. She said the only difficulty she experienced on a couple of occasions was mastitis, which is an infection of the breast and the breast tissue that's producing the milk. And so that was incredibly painful for her, and she had to maintain her breastfeeding through expressing milk and also go on antibiotics, and so she got help quickly for that and overcome that difficulty. So that's a real true success story. She was able to successfully feed 3 children, and I believe she's partway through her next pregnancy and intending to breastfeed her next baby as well. But such success stories are not always the case. I had another friend who definitely intended to breastfeed. However, when she got her baby home, she found it very difficult to establish breastfeeding. So often after children are born these days, there's a quick transit to the home environment, and she just found it really difficult to establish breastfeeding. The baby wasn't latching on well, and it just wasn't going smoothly, and the baby ended up losing quite a substantial amount of weight, which was quite worrying for the health professionals concerned, and she ended up back in hospital. And so it was a very difficult time for her, and basically what happened was she was able to continue expressing her breast milk to keep her supply up, but also supplement the baby with some formula milk. And she was able to gradually help the baby to learn how to breastfeed, and she did get back to breastfeeding her baby, but she actually also continued to supplement her baby with formula feeds. So she was formula feeding for some feeds and breastfeeding for other feeds, and that worked well for her, and she continued to breastfeed her baby up until 14 months of age. And so in a way it's quite a good success story, even though there was some formula feeding involved. And I think that that's actually quite a nice story, even though there was lots of difficulties, that she was able to overcome those to a degree, but that mix of both formula and breastfeeding worked for her, and I think that really should be considered a good outcome for her. I've had other friends who report lots of difficulty breastfeeding, and look, there are lots of, I've even had a dietitian friend sigh at me saying, nobody told me it would hurt. We all talk about how great it is, but no one told me it would hurt. And look, it's not supposed to hurt if you've got them latching on properly and everything's going correctly, but there are lots of different things that can go wrong, from inverted nipples to mastitis to difficulty latching on and technique of suckling. And so there's a number of different issues that can occur which make breastfeeding difficulty. And then in other women, they simply can't breastfeed, maybe because of an illness they've got, or because medication they're using, or if they're particularly stressed, it can decrease milk supply and cause difficulty with feeding their baby. And so I think if any of those things are happening, and it is a little bit more complex and it isn't coming easily, I think it's really important that you seek help early, and that help is available. So we've got, although you're discharged from hospital often quite early now after having a baby, the child and maternal health nurses are there to ring up, to answer your questions, to get them to come out to help you with feeding your baby. There's also specialised lactation consultants, which are very good with that troubleshooting stuff, and when things are a little bit difficult, to try and get some tips and pointers and work out where it's going slightly wrong and how to improve things. Breastfeeding Australia is a great support to hundreds and thousands of women, and they offer really great services in terms of supporting and encouraging breastfeeding, and they can really help with those troubleshootings and difficulties. And of course, then there's your GP and your paediatrician, who can also be there to help. If there's problems with weight gain, or perhaps with some gut and skin reactions with infant feeding, certainly your family doctor or GP, or your paediatrician and your paediatric dietitian can all help with working out the best way to proceed if those things are going on. And there are certain things you can do, both if you're breastfeeding or formula feeding, that can help overcome some of those difficulties if there seems to be some reactions going on, or if your baby's not growing properly. There's some very specialised things to do in that regard. So I guess the message is breastfeeding is really fantastic, and you should try and persist with it, because it's really worthwhile for both the baby and the mother. However, at the end of the day, if you've tried and it's just not working, commercial formula can be a good and safe option. Now, as I mentioned at the start of the blog, there's been, the paleo cookbook for babies recommending homemade formulas, and I've had a couple of people come to me through the clinic also trialing out these quite unusual homemade formulas made of all sorts of unusual ingredients, and it's really quite concerning. Babies are not meant to be eating food. They're only designed to drink mother's milk, and commercially formulated formulas are as matched as closely as a food technologist can get it to human milk. And obviously there's a lot there, as I've mentioned before, that they can't match it exactly, but there's some important things that they have looked at, and that using homemade formulas can be quite dangerous. So just as an example, if a baby's not growing properly, a paediatric dietitian may add things to the breast milk or to a commercial formula to change the concentration and help the baby grow a little bit better. But that's very carefully done. Babies are tiny, they have tiny kidneys and tiny livers, and they can't process very large amounts of certain vitamins and minerals and protein. And so it's very, very carefully done, any alterations to the standard formula. And it's very dangerous to not be looking at those things. And I think the paleo diet recipe for infant formula was found to be really high levels of vitamin A, such that it could cause vitamin A toxicity and death. And so that's the type of thing that you risk if you're doing things at home. Also, I think you're risking a lot of infectious disease and whatnot with contamination, and it's just not a good idea to be feeding babies formulas made out of all sorts of unusual things, whether it be bone broth, livers or molasses. They're some of the things that I've heard recently, so definitely not a good idea. Please stick to commercially available formula or a specialised formula if required, as prescribed by your GP or paediatrician. Okay, so if you've tried breastfeeding, you've ruled it out, it can't work for you, what are you to do to ensure the best for your baby? I think, and there's I guess you should feel confident and safe that commercial formulas can be an alternate option which is safe and healthy for your baby. But there are a few tips I think that can help, and that is that you follow the instructions very carefully regarding sterilisation of all of the equipment, and also that you prepare it very carefully, so looking at the water to scoop of formula ratio and following that advice very carefully. So I think that that can be very helpful. The next thing that I would say is a really helpful thing to do is to hold your baby and hug your baby and touch your baby as you're feeding your baby. Particularly in older babies, they can learn to hold up their bottle and feed themselves. But in breastfeeding, you're obviously holding your baby close to you, you're getting a lot of skin-to-skin contact, and there's a close bond being formed between the mother and the baby. And I think it's best to try and emulate that even if you are formula feeding by holding the baby close to you when you're formula feeding and giving it lots of hugs when you're finished, etc. So I think that that's a really important tip. And the last thing I wanted to talk about was a huge number of commercial formulas available. I imagine for anyone who hasn't been able to breastfeeding, being faced with all of those choices can be quite overwhelming, and it's hard to know where to start. And look, they're all much of a muchness, but there's a couple of things that I would look out for if I personally couldn't breastfeed my baby. And the first one is looking at the protein content. And so all of the protein contents of the commercially available formulas will be within a specified range. That's allowed through the food safety standards. However, some will be a little bit lower than others, and it might sound that more protein's good, but actually I would be, unless your baby's got some growth difficulties, in which case you need specialised advice from your paediatrician or dietitian. Unless that's the case and your baby's healthy and growing well, I'd be going for the formula with a slightly lower levels of protein. So compare the protein content per 100 mils or 100 grams and go for the one with a slightly lower content. Basically, we know that babies who are formula fed higher protein content formulas are more likely to suffer from obesity during childhood, and so perhaps the ones with a slightly lower level of protein content might be better off. Certainly that's what randomized control trial last year showed. So I think that that's worthwhile considering. Another thing worthwhile considering, in my opinion, although the evidence is less solid for it, is looking at the fatty acid composition and choosing a formula with added DHA fatty acids. So these fatty acids that are certainly found in places like the brain and the eyes and important in the formation of those things, and not all formulas have them, and I think that there's not a lot of evidence to show that there's better outcomes with them, but I think there's a growing amount of evidence and that it's worthwhile considering those ones. Other than that, I think they are much of a muchness, so I wouldn't be too worried about the other parameters. There's lots of arguments about casein and whey, and some casein to whey ratios might suit some babies and not other babies. But look, I think for me, the DHA and the protein levels are things that I would be looking out for. So just to summarise and round things up, breastfeeding is an incredible, amazing thing to do for both mother and baby. It is prevents so many illnesses and diseases and helps the mother in so many ways as well as the baby in so many ways, that it really is the gold standard, and it's really important to give it your best shot. If you're having difficulties with breastfeeding, please seek help early. Not everyone finds it easy, and it can present various challenges, but the good news is most of those challenges can be overcome with help. And finally, if you have tried and nothing's working, then please don't feel guilty, and certainly don't get depressed about using a commercial formula for your baby. There are safe commercial formulas available for your baby. And that's all from me today at Dr. Anita Star Nutrition Consultant. I hope you've enjoyed this vlog. It was certainly easier than handwriting or typing a blog, and so I'll be keen to get any feedback or ideas. I'll see you next time.